Hey guys, Wise Guy's a little bit different this week. Gonna do a little PowerPoint. Hopefully you can hear me doing this. So the reason why I wanted to do it this way is this is some Joint Commission updates, and I've really got to make sure that you all understand this. So just wanted to make sure you could kind of hear me talk through some things, because I know sometimes just reading it doesn't get you where you need to be. And I'm sorry I cannot move myself out of this bottom corner, so sorry that blocks out some things. If anybody knows how to do that after this, let me know. I've tried multiple ways, but let me know. So just kind of a few things. I do still want you to send me your red receipt on this, but since this is a joint commission requirement, we have to show proof that we did this education. I do still need to have you all sign the roster. So after you've seen this, read this, listened to this, find me, I'll find you, and we'll all sign the roster together, because we have to show that 100% of our nurses got the education. We also have to show that we were 100% compliant. So there will be audits to make sure that you all are doing the changes correctly. And we do have to show 100% compliance for 3 months. So if we don't do this correctly and there's one fallout, that 3 months starts over. So really just want to make sure that you all get this. Most of it's pretty straightforward, but definitely a little bit more talk about how we're going to do the phase 1 pain assessments. So kind of what's new, just think pain assessments everywhere. So we've got to do a pain assessment, a complete pain assessment in each phase. We've added a full pain assessment to the pre-op screen. We'll talk through some of the phase 1 changes, a full pain assessment on phase 2, even if we're not giving pain medication. And then for the techs and for the nurses, but change for the techs to the pain or no pain that was at the top of the vital sign screen won't be there anymore. So planning on doing education and then rolling to go live with this on March 24th. So on your pre-op, so your kid comes in pre-op, you will do a full pain assessment, and that's required on all pre-op patients. So under your pre-op physical assessment, underneath your trach assessment, there'll automatically be a pain assessment. It's not anything that you have to add. It'll automatically be there. And it is mandatory. You see it's got the star there next to the pain scale, so you will have to chart this before you can get out of this screen. So this one's mandatory. It's already there. These kids are coming in pre-op, probably not in pain, but if you did, if they're screaming, crying because they're mad and they're hungry, you can still do that. You did some interventions on that. So just make sure you're charting that pre-op. So phase 1 is just a little bit different. We'll kind of talk through a couple of scenarios. So think about, you've kind of got 2 different types of patients that roll into the PACU to you. One that is sedated, one that is crazy screaming. So kind of how are we differentiating those? If your patient rolls in and they're sedated, they still have their airway, they're not moving, they're on oxygen, there's no verbal or painful stimuli, you can't get them awake. Just make sure on your phase 1 physical assessment under level of consciousness that you are charting that they are non-arousable. So that is saying they are sedated, and that does not require a pain scale at that point while they're sedated. Now, other scenario is you have a 1-year-old ear tube that comes into the PACU. They're screaming, crying. There's no IV. You're not going to give pain medicine. Or you are going to give pain medicine. So we're going to kind of look at that 2 different ways. So if the patient's in pain and you're giving pain medicine, really no change. You're going to give the medication. When you scan it, that'll pop up your pain assessment and you'll chart that on the MAR. No change on that. The biggest change is if they roll in and you're not giving pain medicine, you will still have to do a pain assessment. So this is already one of the interventions on the phase 1 order sets. It's that non-pharmacological intervention, and I've got some screenshots. We'll talk a little bit about that as we go. But just chart what interventions you tried that's non-pharmacological. You held them, you gave them a passy, you gave them a bottle, you repositioned them. So here's just kind of some screenshots. So like I said, patient comes in, they are sedated. So just make sure you chart down there at the bottom that they are non-arousable, and that covers the pain assessment while they're still sedated. Then on the other side there, you have that's where that pain non-pharmacological intervention is, and then you have a screenshot there of what that screen looks like. So the non-pharmacological is if you are not administering any kind of narcotics, but you still assess their pain and you tried some non-pharmacological ways to help their comfort. So I kind of put this algorithm on here. I wish I wasn't blocking that bottom part out, but let's just kind of talk through this. So they roll into PACU, you're doing your initial assessment. Kind of on the right there. The patient is sedated. You chart unarousable on the level of consciousness on your phase 1 physical assessment. When that patient wakes up, you're kind of going over there to the left side of the screen. So are the patients awake now? Do they roll in irritable? Are they in pain? You're going to kind of think about that two ways. So if they're awake, in pain, you're giving pain medicine. You'll scan the medicine, chart that on the MAR, do that as normal. If you're not going to give medication, just make sure you chart the pain assessment on the non-pharmacological interventions, and you chart what interventions you tried. As far as phase 2 charting, unfortunately this will be just a little bit of double charting. I wish it wasn't like this, but it is just a little bit. So when the patient comes into phase 2, you'll select your post-op physical assessment, and the pain scale will automatically be linked to that. So unfortunately, like I said, it is on that post-op physical assessment, which you have to chart on every patient. But then if you turn right around and go get Tylenol, Motrin, Hyset, when you scan the medicine, you will have to do that pain assessment there as well. Just a screenshot here. Like I said, we are taking off that pain assessment that says pain or no signs of pain. Techs do chart on this screen, so technically that's out of their scope of practice to assess that, and that's something they would have to chart to get out of this screen, so that is now off of there as well. The other thing that we just had to educate on, and it really is just knowing this, so per CMS guidelines, the post-anesthesia notes must be completed within 48 hours of their procedure. So there's not an EDGE policy that says that it has to be done before they're discharged. We do try to get that to them, but anesthesia does have 48 hours to put those notes in. School and work excuses. So we're going to try to go live with this next week, March 18th. Or maybe that's the week after next. Anyways, March 18th is the go live. Really the only change on this is it will not have a signature for you that you signed it anymore. It'll automatically be electronically signed. So when you fill out your school and your work excuses in Meditech and you hit print, this is what it will look like now. It will not have any lines for you to sign or date. It's there. And whoever's logged into Meditech on that computer is whose name it's going to print out. Just some kind of odds and ends. Mallory's last day is March 13th. I've put a sign-up sheet in the break room so we can eat and celebrate / cry that Mallory is leaving. As far as your skills day stuff, I think you all are doing a really good job so far. So just make sure you finish your skills day CBLs. There are some for nurses and there are some for tech, so just make sure what I've loaded in there for you is complete. Once you've completed them, you will have to print out a transcript, or you could take like a picture on your phone, whatever's easiest for you, and you will have to give that to the check-in person at skills day before they'll allow you to actually do the skills checkoffs. And then if you haven't done so, I do have a list of people that haven't. I'm going to try to get with them. But if you've not signed up on the Sign Up Genius for the simulation and the CLABSI stations, please do so. There's 400 nurses going through this, so I want you to make sure that you get a time that works for you. And like I said, those two are the only time sensitive stations. Everything else can be done at any other time, but those two are time sensitive, so make sure you sign up on that Sign Up Genius. And that was from an email. The link to that's in an email that Jen sent out a couple weeks ago. And then RQI is done on, or RQI is due on March 31st. The mannequin is not with us anymore. We had him in February. So if you need to complete your check off on the mannequin, that is down in Sim Center. And then just while I'm doing this, and I wanted to get it on here. I won't go into much detail, but 2 West is really on the struggle bus right now with some morale and just a lot going on. So I would like to do a little something for them, nothing crazy expensive. Maybe we just brought in candy or some Hershey Kisses and just took over there and put in their break room, or just some snacks or something like that. They could use a little help. So ponder that, get with me, see what you think. I'll kind of ponder some stuff too, and maybe we can get something over there to help our little sister unit out a little bit. But yes, like I said, if you have any questions, find me. We'll talk about it. We'll sign the roster, and we'll get through all of this crazy time together. I know there's a lot going on, but just bear with me and we'll get it done. So I appreciate you guys. Have a good day.